there's brain drain
Yeah.
within the medical practice itself, and a lot of your people in recent times, within the last 4 or so years, have actually migrated from this country. They've gone to other parts of the world, talking about the Western world now. Let's first of all look at the effect of that mass exodus within the medical practice in recent times on your job.
Thank you very much, sir. It has worsened the condition in which we practice. Brain drain has multi-dimensional impacts or effects upon our health sector and upon where we practice, which is Nigeria here. In the recent times, in the last 4 years, like you said, the number of people, of medical doctors, nurses, physiotherapists, pharmacists, all healthcare workers leaving the country in droves has gone up astronomically. Now, the impact to operate. So facilities is number one. Number two is the remuneration of healthcare workers. It is, again, abysmal. If you compare it to where our people are going to, if you just say the United Kingdom is also experiencing brain drain. So brain drain is universal. Is all across the world. So
not only in Nigeria.
Not only Nigeria. It's universal. People in the United Kingdom are leaving their jobs because they are not also getting job satisfaction.
Okay, if you say it's not only peculiar to Nigeria.
Yes.
To Nigeria. Are we saying that the move by the House of Representatives, could also be in line, because they are saying, okay, 5 years before you have your license, so you would have practiced in Nigeria for at least 5 years before you can go elsewhere. So if you say it happens in other places as well, are we now saying that what the House of Reps, is actually proposing is a welcome idea?
Far from it, very far from it. It's I will be very cautious in my choice of words. Now, you need to understand the way the medical practice works. Now, when you graduate from medical school, you are inducted as a doctor. With that induction, you are given a provisional license. The provisional license means that you can only work for a maximum period of 2 years. It's maximum period of 2 years, but the delineation of housemanship is for 1 year. So you work for 1 year under supervision of a specified consultant, which means that there are some decisions you cannot take. You are not liable in law as a provisionally registered medical doctor. You are not liable in law because you cannot open a practice of your own. You cannot attend to patients independently without the supervision of your superior, which is your consultant or the senior registrar or your registrar. So they are not fully licensed to practice. This same set of doctors, house officers, cannot go for NYSC without being fully registered. Now, this bill proposes that their full registration be delayed for 5 years. Now, the question is, do you want doctors that are not liable, doctors that are not being fully registered, to take care of Nigerians for 5 years? Now, that is not correct. They need to be fully registered to be able to offer service. Now, the bill also presupposes that the medical education in Nigeria is rather cheap or subsidized. It is not only medical education that is subsidized in Nigeria. Media education is subsidized. Engineering education is subsidized. The tech bros and techies are leaving the country in droves.
Are we really sure?
Even more than the medical practitioners.
Doctor, before
you should not.
Before you came in, we were talking about the fuel subsidy.
Yeah.
And our guest was. A caller called in and said, it's like this and it's a scam. It doesn't really exist. Now you mentioned something about subsidy. The bill actually said that they're subsidizing education and all that. But in reality, is there anything being subsidized for Nigerians?
In reality, if we look at the quality of education, the quality of training that our students in Nigerian university, not just federal universities, state universities, and a few of the private universities, what they receive in Nigeria can at best be said to be subpar compared to their counterparts in other parts of Africa or even in other parts of the world. So if we have that, it means that you're not offering the best that you can. Now, medical practice appears to be the only profession or the only part of the Nigerian academic system that appears fit for the job that they've been assigned to do immediately after leaving the university. But it's not even completely so, because it is the housemanship period that refines those doctors to become suited, fit for the United Kingdom, the United States, Australia, and every part of the world to come and poach them. So the university system is not, as it were, optimal. So, but I would say that yes, there is a subsidy.
Okay.
That is the truth. There is the Nigerian educational system is hugely subsidized.
Okay.
Now let me put it to you this way: the salary of a medical professor or a medical consultant that is needed to train a set of medical students, if you put together all the amounts that the medical students are paying per that year, it will not pay the salaries of those medical consultants or those medical professors. So you would say yes, education, not just medical education, technical education, engineering education, media education are all subsidized. But what is being offered as even subsidized education is not in tandem with the current realities of the world that we live in. And that's why if a lot of Nigerians, especially young ones, would not agree with me that there is even subsidy of education. Because what they are paying that meager amount, for, does not make them fit for their job when they come into the industry. So for example, somebody graduates electrical engineering, but he cannot repair a bulb. He cannot even fix a lamp. Mechanical engineering still calls roadside mechanics to fix his car. So the education that Nigerian University offers them is not at par with it's at best 20, 30 years out of date.
All right, let's look at what the NMAs, said about the bill in response to the bill. It's saying that it's against the international labor law.
Yeah.
What do you have to say about that?
Okay, now the international labor law prohibits any form of slavery or compulsory service. That means you are made to work against your own volition. Now, the Human Rights Charter is clear that you cannot have slavery, or you cannot make people work against their own wish. So when you presuppose that doctors that are qualified, trained, should be debarred from having their permanent license, which they should have after 1 year, and you want to make that 5 years for them to work in Nigeria compulsorily, when you're not varying the factors, the push and pull factors that is making them to leave the system for the greener pastures, it means that you're putting them under slave labor. You're putting them under that direct position that is against the international labor laws. So you cannot expect that a doctor should. Now the problem is even that when you even keep those doctors, there are currently doctors that are not employed in Nigeria or that are underemployed in Nigeria. People want to come into residency training, there are no slots. People want to come into subspecialty training, there are no slots.
But why that? What's going on?
Now it's bureaucracy. Now, employment in my own center, University College Hospital, the last set of employment of doctors was done in 2020.
The next 3 years ago.
Yes, the next one is currently being done now. So you have a gap of 3 years, and what's the problem? You need to write to the head of service of the federation to get a waiver. The CMD would have written express intention to employ people, but you need to write to the head of service. The letter goes to the head of service, it goes to the Ministry of Health, it comes back from Ministry of Health, it goes to budget office, from budget office it comes back to the office of Association of Resident Doctors and the Nigerian Association of Resident Doctors, NAD, Nigerian Medical Association, and all well-meaning Nigerians have expressed strong reservations for this piece of legislation, and I'm sure that it is not going to be passed into law. Even if it is passed into law in the House of Reps, there will not likely be a Senate concurrence. And even if that happens, it will most likely not receive presidential assent because there are strong legal resistance to this piece of legislation. So what should be my advice? My advice is that our legislators, our lawmakers, our government should feel the pulse of Nigerians, should come down to the stakeholders in the Nigerian education, healthcare, and leadership, and seek what are the realistic interventions that could be done to stem the tides of brain drain, not just in the medical profession, but for all young Nigerians across all sectors, because you need to inspire hope in Nigerians. And that's why any of the presidential candidates of all the parties were talking about hope. You need to inspire hope in Nigerians. You need to make young people see that staying in Nigeria, you're not wasting your talent.
For them to believe in the Nigerian dream.
You need to even have a Nigerian dream. So not just believe in Nigeria. You need to have a Nigerian dream that is bright enough to keep somebody in Nigeria.
Yeah. Thank you very much, Dr. Oladapo.
It's a pleasure speaking with you.
All right, we'll be speaking with Dr. Oladapo, a medical practitioner with UCH here in Ibadan. And it's been a very insightful one at that. And this way we're going to be drawing the curtain on this episode of the program today. My name is Kenny Oriri. Enjoy the rest of your day.
All right, join us same time, same station tomorrow on Impact Television. I am Joy Aibi. Good morning.